So we will talk about what Australian pharmacists can do. We can do emergency supply of medication, but it's only 1 month only. Yeah, for sometime when patient they run out of the medication, they run out of their blood pressure tablet, and they can't find a doctor. The appointment may be next month. So, in the past, we can't do that. We can only do 3 days. We call emergency supply. But now, pharmacists can do 1 month. Yeah, before like to fill the gap between they see the doctor next time. And the pharmacists can do generic brand substitution. Yeah, because when doctor prescribe the medication, there are so many brands on the market. Yeah, for example, even the amoxil, or the Nexium. There are so many generic brands, so we can substitute the brand, but you have to ask the patient, yeah, are they happy to get the origin generic brand？ 这个 generic brand 的意思在中文就是学名药，所以在澳洲我们是可以用学名药来替代原厂药啊，但是你要取得这个病人的同意。然后呢，在澳洲的药师 ，Australian pharmacists can even do this. For like a couple of years ago during COVID, sometimes this would be like drug medication shortage, and sometimes we only have 250 milligram, but the medication, for example, is 500 milligram. So what can we do? Normally, before COVID, we can't do anything. We have to call the doctor to say, can we change to 500 milligram or use 2 capsule for 250 milligram? Yeah. But now, after the COVID, yeah, due to certain reason, the medication is out of stock or you can't get it, we can change the dosage. Yeah. Okay. And for in Australia, all the medication will be you have to pass the PBS. So the PBS 这个 PBS 就是像类似台湾的所谓的健保局的药品的这个给付的这个范围啊。So any medication, if you want to be prescribed and covered and subsidized by the government, you have to apply for a license for PBS. That way, government can pay you. And in Australia, we have 2 different category of patient. One is I think my slide is wrong. Normally for the general patient.
不好意思，想询问一下刚才的那个上个 PPT 的问题。
PPT， 对，那个
对，就是您说，如果药品的，比如500 milligram， 然后但是可以用2颗250来代替，那这样表示就是连频次在使用上的频次都是由药师可以决定频次的改变吗
？Yeah, I think the question she asked 你是哪？因为我这看不到名字，你是 Aaron 还是？
我是玉芬。
玉芬，好，对。So 玉芬's question is, if we change the dosage, should we change the quantity, or can the pharmacist change the quantity? 基本上 we will do according to the total quantity patient can get by prescription， 就是说在处方签上，如果医生开了是500 milligram， 然后有可能2次的慢签，那我们就可以根据这个总量，然后你再改成250的话，你的那个量是不是就要增加？我们可以这样改的。
所以我改变的是 quantity 而已，还是我就是因为如果我改变 quantity 的时候，我的颗数就会跟着改变。那这样的话，我服药的那个频次 frequency 是可以跟着改变的吗？
对，可以，可以。
哦，好，谢谢
对
老师。
，OK. So in Australia, when we change the maybe change the dosage on the prescription, we can also change the quantity patient can get. That way, yeah, because the medications doctor's intention is to use for 1 month. So we have to make sure when after we change the quantity, patient even we change the dosage, patient can still get 1 month's cover. Yeah. So this slide 这张投影片也是错了，是那个general should be 3170。那 concession 就是那个有那个折价那个什么那个类似像中低收入的或老人，他们每一次 when they have one prescription dispense, they only pay for concession patient they only pay $7.70 per prescription, and for general patient they pay up to 31.70. Anything up above 31.70, government will pay for it. And they have a total amount or threshold they pay annually every year. So that's the limit. Yeah, that's what we can we just talk about. Pharmacists can do vaccination, and what vaccine Australian pharmacists can do in Victoria. So here is the list. Okay, for example, the flu vaccine, or meningococcus, or the MMR, or the diphtheria, tetanus, pertussis. Yeah, and lately we have you said monkeypox, right? Yeah, or even the shingle, the herpes zoster. 所以这张 list 这张单子这个表格就是表示就是我们目前澳洲的药师，我们可以给这些预防接种的疫苗。OK，
老师，不好意思，就是我想请问说，就是那个疫苗啊，是药师是可以帮病人施打的意思吗？
对，没错，从头到尾，连钱我们这边都收了。Yeah.
那会就是施打前就是会需要就是先去做训练嘛？就是有没
对，
有就是会需要去
你需要去就是你要参加一个那个训练，然后你要可能大概只有1天，你会有需要做什么 CP 啊那些急救的课程，还有那个书面那好像那个 reading 的这个部分考试，然后最后会参加1天的实作，教你怎么去打针，然后我们互相2个人互相你打我，我打你这样子。Yeah.
哦，好，谢谢老师。
对，你们有问题 ，any question just ask. Yeah, doesn't matter you're in English or Mandarin, doesn't matter. So the question is, if pharmacists wanted to do all the vaccination, they have to be enrolled in a course, and sometimes can be a first aid course, couple of days, and they have to finish the module over the internet, and also they have 1 day full day to course to learn how to do the needle. So we normally would jab each other. Yeah.
老师，我想要再问一下，在上一章那个 就是 general 7.7那边是什么意思？就是那个
general patient 一般
就
的病人。
是这张 PPT 这张 PPT 的意思是什么？我没有很了解。
OK，就是说我这个有写错了哈，这个 general 就是一般病人，就是他不是我们在药局里面哈，病人他在付钱有2个等级，如果你是有那个什么中低收入啦，你就是属于叫做 concession。那 concession 的话是每一张处方签7.7块。我这里说每一张处方签其实是指每个药，一张处方签上有时候会写3个药，所以病人就要付3个药的钱。然后也
concession 是负7.7还是负31.7？因为不是中低。
我写错了，我刚刚说这个 concession 实际上是7.7块。
那是这样 general 是7.7吧
？No general 我写错，我这个 slide 是
就是
错的。
相反
对，刚好相反，我刚刚没有注意到。对，说 general 是付到31.7块，31.7块以上是政府付的。
是指每一种药
每一个
31块。
药，每一个药，对，如果他开了3个药，那不好意思，那你还是要3个药多少钱，就每一个加起来这样。
那第二个那个 safety net threshold
safety net 就是有一个上限，你等于说你可能付这些钱，你付到一个上限以后，就会如果你是 concession 的病人，你付到那个277块，你今年付到277块以后，你就不用再付了，不用再付。
今年是指说好几次看病，然后总共累加起来，还是只单一次的看诊？
例如说，我刚刚不是那个 concession 不是7.7块吗？那你277.2除以7.7，大概是36张处方签。
所以如果我这整年度总共拿36张处方签，每一次处方签是一种药的话，
对，
就是我是这样算的。
所以你付到第36张以后就不用钱了。
那我想问一下，
除非你是买原厂药，原厂药它会有一个价差，它会比较贵，那你就是只要付价差就好。
那我想问一下，这个的价格是只有在讲他们去拿就是药品的时候，那
这个是
看诊
药品
额外
看诊是医生的，医生又有另外的一个上限，自付额的上限。对，
好，了解，谢谢老师。
Yeah. 对。Okay, so yeah, this is a very famous spot in Sydney. Yeah, Blue Mountain. I went to Sydney last week, so I took a photo for the Three Sisters. 所以你们有机会到雪梨或澳洲去玩？如果到雪梨的话 ，you can go to this Blue Mountain National Park and Three Sisters. That's a very famous spot or play. Yeah. Okay. Yep. So normally what pharmacists what's their job? What's their daily routine? Yeah. For example, that's my daily routine when I work in a like community pharmacy. Yeah. So most of the time I have to do counseling and or the BAA, yeah, or sometimes the document signature certification and a phone call. And we also do methadone or Suboxone patient. Do you know what is methadone? 你们知道什么是 methadone 吗？在台湾可能叫做美沙东。
对，管制药品。
对，就是如果 if people they using drug like heroin and you normally take those medication, you have to either come to the methadone, you have to come to pharmacy every day. But for Suboxone, people can have um, because the half-life for this medication is longer, so they can take like 1 dose every 2 days or 3 days. And also they can have takeaway. Takeaway 就是说你可以带回家，就是 you have 1 dose in the pharmacy on site, and the rest of the sometimes because they have to work every day, so they can't come to pharmacy every day. So sometimes they had 2 takeaway, 3 takeaway. It depends on the trust you build between you and the doctor. If doctor can trust you, they give you 5 takeaway. If doctor trust you more, they give you maybe 1 week takeaway. Yeah, so they don't need to come to the pharmacy every day. And the last one, yeah, vaccination.
老师，那个不好意思，就我
对，
想请问说，因为就是我们在医院实习的时候，就是美沙酮，就是它的管制其实是蛮严格的，就是可能就是会有特定的，就是会有一些就是要确认身份才可以领。那在就是澳洲的话，就是只有那个沙巴送可以领回去，就是可以领回家。那他会就是说会需要说特别就是登记说你一定要是什么样的人，就是可能你领的时候会可能要记录名字，或是说还会比较像就是一般的药这样可以直接拿。
其实，在澳洲做这个 methadone 已经有三四十年的历史了，所以说 methadone 这种东西是每天它的半衰期是只有1天，也的 half for methadone is only 1 day， 所以 they have to come here, come to the pharmacy every day. They have to take the dose every day. 所以我们在澳洲没有，我们就他们通常我不知道在台湾可能比较麻烦的，在这边是很容易，我只要确定他是本人，我就给他了就好了。
嗯，
而且他每天来我都认识，他们可能还没走进来，我在停车场看到他，我就已经准备好要给他了。也、对啊，对，就是要这样。然后唯一可以带回家的是那个 Suboxone，because Suboxone is naltrexone plus the buprenorphine，所以说 Suboxone 比较不容易被 abuse，因为他们有一些人会再拿去打，可是如果他把那个 Suboxone 打进他的身体的话，他会很痛苦。或者说没有，或者是说没有效果，因为它里面有 naltrexone，naltrexone 是一个 antagonist，对不对？就是那个解毒剂啊。但是当它作为口服的时候，其实它的 naltrexone 的剂量很低，所以不会有太大的问题。
所以是施打的时候，那个那时候会让就是施打的人会觉得不舒服，所以就不会让他
不是
们就是
不舒服，
一起用。
他们想要得到的那个 euphoria，they will lost the happiness。
会没有那个效果。
对对对，但是 methadone 就没有办法，methadone 它就是他们很多人以前可能很多人会来药局，就当着你的面，然后说 take away，或者是把那个剂量哈，他会自己藏起来，你知道吗？那你就要去抓他，就抓他说马上给我交出来，对对，会发生这种事情。但是后来 Suboxone 有 Suboxone 以后，就比较不会有这个问题，因为我就可以给他，我也不用担心说他拿去会做什么用，因为他不能做什么用，因为他没有办法拿去打。可是 Methadone 就可能会被拿去打，对
哦，好，谢谢老师。
，OK。Okay, and starting from last year, in Australia, in Victoria, we have a pilot study, so which is will encourage like pharmacists, like we can prescribe something, and so for example, so we can treat the sick like shingle, because sometimes shingle you have to take the antivirus tablet as soon as possible, like within 48 hours. So by the time they see the doctor, it's too late. So now we can treat, but only this is only the study. Only we have a one year study. So after that, we probably will do more. And the second one is, the just psoriasis, we can treat that, or even the contraceptive pill. If the patient been taking contraceptive pill and they can't find the doctor, they can't see the doctor, or we can supply that without a prescription. And also for the UTI, urine tract infection, we can prescribe the antibiotic to the woman, only for the woman. Yeah. 所以在澳洲的我们药师现在有一个1年的一个那种研究，就是一个计划啊，所以我们现在开始就是尝试由药师来治疗这个熏狗，要怎么说？熏狗台语叫做皮爪，但中文叫什么？
带状疱疹。
带状疱疹，对 ，yeah。So shingle, we can treat shingle。还有 psoriasis，就是这些牛皮癣啊，这是属于免疫类的疾病，或者是避孕药，或者是这些简单的在女生非怀孕女生，就是这种简单的尿道感染，我们药师都可以给，可以开药，然后我们会得到。我们工会会付给我们钱做这件事情。对 ，Okay, daily routine done. Okay, so this is we call dose administration aid, DAA.
Professor.
Yeah. Question. Your question. Yeah. Go ahead.
Yes. I have a question. Like you say that the contraceptive pills they can give to the women without a prescription.
Correct.
As you know, there is a lot of tragedy related to contraceptive pills. Maybe like there is uncontrolled bleeding. Maybe patient will die. At that time, who will be responsible? If a pharmacist prescribed.
So there's a criteria when you decided. So you probably didn't see the my slide properly. I'll show you the slide. Yeah. So see, here it says resupply, which means the patient is already on contraceptive pill. They're already seeing the doctor, and maybe because they can't see the doctor or they have problems making a booking for the doctor, so we can resupply without a prescription for a woman.
Oh.
Yeah.
Okay.
Yeah.
Yes,
So the only when this woman, we can't give the contraceptive pill to a new patient, but for existing patient we can. Yeah.
Okay. Thank you.
Okay. Yeah. Good. Okay. So this is Webster. This system we call Webster in Australia. So you just put the medication in like a weekly base, Monday to Friday, and breakfast to lunch to bedtime. Yeah, put it in that. Yeah. So that's DAA, and we get paid from Guild to do this. But there's a limit of the patient you can claim from Guild. Yeah, maybe like 20 patients or something. Yeah. Okay, so when you do the Webster, it's just something like this. You put the medication into the plastic slot, yeah, and you store the medication like this. We call rhombic, yeah, because there are so many. We have to keep all the aged care patient medication in the shop. So sometimes the pharmacy are community pharmacy we are too small. So you need to have something like this system to help you to store those medication. And remember the last pharmacy I worked for 20 years, they have at one stage, we have about like aged care patient, about 400 something patient. Yes, it was quite busy and quite stressful when doing those Webster. Yeah, and a lot of phone call. You had to have to call them and changing the drug weekly. Yeah, you have to send a new one to to swap the old one back. Okay, so that's the the floor plan or setup for community pharmacy. So each computer, the guideline is, the regulation is, at each computer you need to get a printer. So you can't share the printer, because when we print the repeat mean you can get the second medication the next month. You can, so each printer go with each terminal, each server. You can't share the printer, like 3 computer, 3 dispensing counter. You can't just use one printer. You have to have 3 different printer. And that's the shelving. Yeah. And that's the DD safe. We have a safe to put those control drug. So there are so many control drugs. So in the pharmacy, you can see we have so many DD safe. 所以在澳洲的一般的社区药局，我们这种管制用药的保险箱有很多，因为有太多的药，不是像台湾可能就只有用几种，在澳洲用很多很多。Yeah. Okay, and this is the label system used in Australia. So pharmacists graduate from the graduate here, we need to learn this system. Like level 1, from level 1, level 2 to level 20 something. And also, so we call this label cautionary and advisory label. I will show you how to use those label later. Yeah, for example, my cards. So you can you see my 你可以看到我这个游标的那个滑鼠的游标吗？ Yeah, okay. So from this label, you can see number 11, number 12, number 16. So that means in this medication, in the dispensing, you have to put number 11, 12, and 16. And number 11 is do not take potassium. 所以我们知道说 mycarditis, you can't take too much potassium, because for those drugs, you will keep the potassium in the system. So we have to put those label. And any S inhibitor or those medication, we have to put 11, 12, and 16. 这一类的药我们都需要放这3种警示的这个标签。所以 when you're doing this every day for 20 years, so it definitely you know what to counsel, what to do the patient counseling. Yeah, because counseling you have to tell the patient, oh, you do not take this potassium, and level 16 is like if the because blood pressure tablet, when you when they first start taking it, for the first couple of days, they will feel dizziness, lightheaded. So you have to advise the patient, do not stand up too quick. Yeah. But normally those side effects will, after couple of days, the patient, their body will get used to it. But you have to tell the patient, otherwise, when they start taking it, they feel those side effects, they will stop taking it. So it's very important for the patient take it the first time when they're taking any new medication. Pharmacists here, we always need to do counseling. Okay, so that's the pelican in Australia. I don't know whether you see pelican before. 这是我们 pelican， 这个中文是什么？这叫什么？鹈鹕吗？鹈鹕。
Yeah, it's like a kingfisher.
Yeah. So, so you can see the crow. The crow is silver. The color is silver. It looked like you use a spray pen to paint it. It's quite like unreal, you know. 它这个脚就是 你如果真的现场看哦，你感觉它好像是穿上一个塑胶的，好像喷漆喷过的那种那种手套还是脚套这样子。对 ，OK， and reference book, yeah, normally in Australian pharmacy, those reference book are required and mandatory. 所以这些在每一个药局，这个都是属于必要的，就是说每次那个他们一定会看你有没有这些参考的资料啊。Okay, so this is what Australian prescription look like, and the card there, this is Medicare card. So when they want to have anything dispensed, they need to present their Medicare card for general patient, and if they are concession patient, they need to present their concession card. So with those card, we can get the subsidy from government. And that yellow paper is a repeat. 所以这个黄色的这个部分呢，就是这边的所谓的慢签。So sometimes each medication they can get like 5 repeat, and sometimes can up to 11 repeat. So all the prescription, for example, if they see the doctor today, the prescription is only good for 1 year. 所以通常他们的处方签呢，医生有时候会给他们可能2到3次哦，通常一般都会是5次。有一些慢性用药，有时候会给他们甚至1年的用药，也就是11次的慢签啊，这就是1年的用量。然后处方也会有那个有效期限，通常就是1年，就是你今天看医生，它的有效期限就是1年。然后你这个慢签呢，你要把它跟那个原来的那个处方签会有一个那个副本的部分，你要把它并在一起，然后才能到其他的药局去拿药。Okay, and that's our dispensary system. Okay, and normally you select a medication and in the direction, you put a direction, and you can also put a repeat and also quantity. Okay, and normally we use this, we call SIC code. SIC code is something will make your dispensing easier. For example, you can see SP. What's SP mean? SP mean sparingly, and D mean daily. Then AD mean as directed. So the whole direction is 就是 apply sparingly, daily, as directed. Yeah. So we use that short code to do the dispensing, make it easier. And here, you will see when we dispense anything, then you can claim the money spontaneously through the system, government system, and they will tell you is it successful or decline. 所以在澳洲的话，你的调剂系统呢，它有一个即时申报系统，就是你马上调剂完，然后它就会告诉你这一个处方签是可以还是不可以，政府有没有批准，这个马上就会告诉你。Because in the past we have to send like couple of box of original script every month to the government, and we only know which one been rejected or which one is passed. The next month they will send you back a report and say, okay, in this prescription there's a mistake, so we can't subsidize this money or something. But now for the this is immediately spontaneous system. You can know whether you get the money or not. And
老师，我想问一下，如果被 reject 的话，是当下要做什么处置吗？
会就是 normally so you can see the 如果是被 reject, you will see a red message. Then you will know you have to find out maybe some detail is wrong. Maybe you type in the wrong day. And because some 有一些药呢是属于这种特殊的用药，所以有时候医生要先跟 they have to some medication need approval from the government first. So when you dispense those medication, you have to look for the day is correct, doctor's name is correct, and also this will be a authority number and also a approval number. 所以你要 check 这些东西，然后这些东西都对了，还有你选的那个药也对了，这个时候才会不会出现红色的。所以这个的好处，因为以前我们通常要经过1-2个月才会知道说啊，我这个地方打错了，那个地方弄错了，我可能给病人错的药。但是现在这个即时申报系统，你马上就知道你这张处方签你给的对不对？
了解，谢谢老师。
And also, if there's a drug interaction, the computer system will warn you, yeah, straight away. And in Australia, we like maybe 10 years ago, we already have that barcode scanning system. So this system will help you to get the right medication. You know, sometimes when you select a medication from your shelf, 10 milligram, you probably get 25. It happened. And also about 99% dispensing error is from selection. You select the wrong strengths or wrong medication. So how can you prevent this mistake happen? So Australian, they create a barcode system. So when you dispense the label, you will see there's a barcode. So when you scan this barcode, the computer will tell you, okay, this is baclofen 10 milligram. Then you go to the shelf to select the medication, 10 milligram. Make sure you get the 10 milligram. If you get a 25 milligram, what would happen? When you scan it, it will tell you there will be a warning red and also a big voice like boom. So you'll be scared. 所以如果你拿错药哈，你就会出现这个错误的信息，而且会有一个很大的那个声音，好像警告你说你拿错了。So, 你通常 how often would you see this error message every day? I will tell you at least 1 or twice. So which means pharmacists make mistake every day. So by using this system, you can reduce about 90% dispensing error.
It's very good. Sounds good.
Yeah, but this system, they started in like 10 years ago. Yeah, and still a good system because it takes time for pharmacists to get used to scan the label. Because in the past we don't like to scan the label because that slow you down. Yeah, but after using that, you find that this system is really help you and protecting you. Okay, so if you select the right one, you will comes up with a green message. Okay, and this is the compounding pharmacy I work. So you can see that's the setting, and you can see there's a lab. So in this lab, you can see a lot. We have about